Welcome to Medical Mysteries, where we explore perplexing health conditions and the incredible journeys patients go through to find answers. Today, we bring you the story of Arthur Kimbrough, whose persistent sore throat turned into a life-threatening situation that took more than a year to diagnose. Arthur, a 76-year-old Florida resident, first noticed pain under his tongue in December 2020. It wasn't a typical sore throat, swallowing didn't hurt, but the stabbing pain radiated down his neck and left shoulder. Doctors ran tests, administered drugs, and performed scans, but nothing seemed to alleviate the pain or explain what was wrong. For more than a year, Arthur saw numerous specialists, including ENT doctors, neurologists, and anesthesiologists, without finding answers. Doctors suspected issues like TMJ, spinal stenosis, and even trigeminal neuralgia. But none of the treatments worked, and his pain continued to worsen. In February 2022, after months of escalating pain and difficulty swallowing, Arthur flew to Baltimore for a consultation at Johns Hopkins. As he sat in a waiting room sipping a Coke, something terrifying happened. Blood suddenly began gushing from his mouth and nose. His situation quickly turned into an emergency. Surrounded by medical staff, Arthur was rushed to the ER where doctors discovered a massive 6-centimeter tumor in his throat. It was determined to be stage 3 squamous cell throat cancer caused by HPV-16. The tumor had been growing for more than a year, pressing on nerves and irritating an artery, which eventually led to the hemorrhage that nearly took Arthur's life. Arthur's cancer was caused by the human papillomavirus, or HPV, which infects nearly everyone at some point in their lives. In most cases, the infection clears on its own, but in some cases it can cause cancer. A vaccine is available and recommended for young people and adults up to age 45 to prevent HPV-related cancers, including cervical and throat cancer. Arthur's doctors stabilized his condition with an embolization to stop the bleeding, and he underwent intensive treatment for his cancer. Thanks to quick medical intervention, Arthur survived the ordeal and has since completed cancer treatment. His feeding tube was removed in July 2022, and while he can't eat solid food, he's back to work playing the trombone and living life to the fullest. Arthur's journey is a powerful reminder of the importance of early diagnosis and the critical role of HPV vaccination in preventing life-threatening conditions like throat cancer. If you're experiencing persistent throat pain or difficulty swallowing, make sure to consult with an expert and explore all potential causes.